Hi, it's Dr. Weiner, and I'm talking to you about Vanquish right now. And Vanquish ME, Maximum Energy, which is the newest version of Vanquish, is used to reduce abdominal fat and thigh fat, also for the bat wings. So it does it non-invasively with absolutely no downtime. What it does is it uses radiofrequency to heat up the fat to a point that it eventually dies. And most people are now familiar with CoolSculpting, which cools the fat down to a certain temperature and it eventually dies. Well, the same is true if you heat the fat up to a certain temperature, you get what's called apoptosis, which is programmed death. And so you end up killing off some of the fat. So it does not affect any of the skin or blood vessels or muscles or nerves in the area, but it does affect the fat. And what it is, it's about a 45-minute procedure that you sit here, and the administrator tunes it to a certain level so that you're comfortable, but we're getting good radio frequency conduction. And you sit there for approximately 45 minutes. Sometimes if it gets a little hot, we can put a little fan on you and that cools people down. So you usually need between 4 and 6 of these treatments, and you usually wait approximately a week between treatments, but we've gone as many as 2 per week. And this handpiece is designed to hit the flanks as well as the abdominal area, whereas the CoolSculpting can only hit one flank at a time, and then it has to hit the abdominal area maybe even 2 more times. This does all those areas in one shot. So the other thing that this is good for is the people that are actually fairly obese. The people that are too obese are not good candidates for the CoolSculpting, because when you attach the handpiece to the CoolSculpting, it's potential that you actually can get some divots in the very obese people where they were placed, because there's actually areas of demarcation. But this doesn't happen because you're treating such a wide area, you don't get those lines of demarcation. Also, because we're treating it 6 different times, each area is going to have a little bit different area, and you also get a little feathering. So you don't get that potential risk with Vanquish that you potentially can get with CoolSculpting. The other thing with CoolSculpting is that you need to actually have an area that you can pinch, that can actually be suctioned into their handpiece. And you don't have that with Vanquish. This can treat people that are extremely thin as well, that have a very little amount of fat. Each of these technologies treats approximately 20 to 25% of the fat. So if you want more treatment after 4 to 6, you just keep on going and get another 4 or 6. So this handpiece is good to treat the abdomen and flank area. We have another handpiece that treats the legs, the inner and outer thigh. And again, with the CoolSculpting, you'd have to treat the inner thigh and the outer thigh. But with the Vanquish, you can treat them both at the same time. And so it would be 1 treatment for each leg, approximately 30 minutes per leg. We can also treat the arms. What we can't treat with the Vanquish is bra fat or gynecomastia, which we can with CoolSculpting. So this offers an alternative to CoolSculpting for certain people. And there is a little bit of discomfort with CoolSculpting, and there's none with this. So each one has its pluses and minuses. One other thing that we've got here is called the Zimmer Z-Wave, and that's right over here. And what the Z-Wave does is it improves the outcomes of both the CoolSculpting and the Vanquish. Okay, one additional component of your Vanquish treatment and also your CoolSculpting treatment is what we have is called the Zimmer Z-Wave. Not all places have this, and I want to tell you the advantages of having this. What the Z-Wave is radio pulse technology. And what that is basically sends shock waves through the skin into the fat area. It's actually developed for physical therapy to help with sore muscles as well, but there's a study, or several studies now, that show that when you use this after either the CoolSculpting or the Vanquish, that you increased your kill rate of these fat cells up to 100%. The average is about 68%. So what it does is it basically, you run it over the skin, and I'm not going to turn it on because it's actually fairly loud, but you run it over the skin. It's a 5-minute procedure, so it adds 5 minutes to the area treated. So if you're treating the abdomen and flanks, approximately another 10 to 15 minutes. And you run it over the skin. So if you can think of it very simply as is when you get these treatments, either the Vanquish or the CoolSculpting, you have cells that are eventually killed, you have cells that aren't killed, and then you have fat cells that are sort of borderline. They don't know which way to go. Should I die or should I stay? And what this does is it pushes them over the edge so that the ones that are iffy go into the apoptosis, the programmed death. So we add this as a complementary treatment because we feel that we want the best outcomes for our patients. And so you get it complementary with each of your Vanquish treatments and your CoolSculpting treatments. So that's called Zimmer Z-Wave. So please give us a call at 850-622-1214 for more details. Thank you.